Concerns around Black maternal mortality have gained urgent attention in Los Angeles County, California. Black women here face childbirth risks far higher than their white counterparts. For families and neighborhoods, each loss or injury sits like a wound that will not heal. The health of mothers ripples through entire communities, shaping futures and generational well-being. As focus shifts towards solutions, gaps in care and disparities press leaders, advocates, and residents to act. Addressing this crisis has become a public issue across health and equity commitments for LA County. Film producer and healthcare advocate Dana Guerin explores Black maternal mortality's serious circumstances, policy actions, and institutional change in LA. County effective policy is the foundation for change. Los Angeles County has shifted rules and norms to protect Black mothers. County supervisors pushed legislative steps funding maternal health. The board approved budget lines for Black maternal outcomes, giving hospitals and clinics tools to work with. Funds support direct programs, public health training, and research. Local officials mandate protocols serving Black mothers directly. Hospitals must follow guidelines for respectful care, screening for complications, and fast referrals for high-risk pregnancies. These rules are mandatory. Oversight teams review compliance through visits and anonymous patient feedback. Access changes everything, says Dana Guerin. Officials prioritized insurance reforms to break cost barriers for prenatal visits. More Black women qualify for pregnancy-related coverage under California's Medi-Cal, but more must be done. Health centers in South LA and Inglewood expanded hours, equipment, and multilingual staff to meet needs. Clinics added walk-in prenatal appointments and peer navigator services, helping Black women get care sooner with less red tape. Each contact reduces undiagnosed conditions, preterm birth, and infections. Culturally responsive care is central. Staff training, clear signage, and peer feedback address bias and foster respect. Rules require anti-bias and equity training for staff at publicly funded maternity sites. Curriculum draws on experiences of Black parents and workers, showing real-life bias, like being ignored when reporting pain or unheard during labor. Progress depends on accountability. Hospital managers report training outcomes, with some linking pay or accreditation to compliance. Partnerships with community groups ensure lessons are relevant and truthful. Some centers invite Black birth partners to co-teach, building empathy and respect. Community prevention and public engagement. Prevention begins in communities. LA County's public health teams know programs work only if people trust and use them. Campaigns focus on community voices, trusted neighbors, and culturally rooted networks. The county funds Black maternal health events at churches, rec centers, and schools. Flyers and videos share real stories of mothers overcoming birth challenges, building strength and knowledge. Grassroots projects connect new mothers with sister circles, peer groups led by Black birth workers, nurses, or doulas. Trust builds step by step. County workers partner with neighborhood self-help groups to spread evidence-based messages on safe birth, warning signs, and where to get help fast. Effective education values local knowledge, lived experience, and simple language. Birth support roles have grown. Doulas, now essential caregivers, work in hospitals and homes, guiding expectant mothers through pregnancy and birth. Shared decision-making models allow Black mothers to shape care. These partners co-host forums, review flyers, and sit on hospital advisory boards, notes Guerin. Including faith leaders in prenatal education led to higher attendance at checkups in some neighborhoods. Neighborhood health fairs, co-led by trusted Black physicians, drew hundreds to get screened and learn risk signs once ignored. Results show partnership value. Neighborhoods with engagement programs report fewer missed appointments, higher satisfaction, and more early interventions for high-risk pregnancies. Families seek care when trusted voices, not distant officials, recommend it. Doulas, midwives, and culturally skilled workers improve birth outcomes. LA County expanded doula care beyond boutique clinics, making it available to low-income Black mothers at little or no cost. Each doula builds one-on-one bonds, coaching mothers through appointments, labor, and postpartum. Midwives work closely with hospitals, bridging medical rules and Black community traditions. Patients with birth support report fewer surgical births and complications, as personal support boosts confidence and safety. Hospitals now recognize doulas and midwives as essential care partners. These changes help neutralize old biases sidelining women of color or denying culturally aware care benefits. Our work must continue on every path to better outcomes. Doula program expansion includes clear tracking, measuring safety, comfort, and satisfaction gains. LA County's response shows how policy, prevention, and public engagement drive change when combined with community wisdom and data. Funding boosts, accountability, and anti-bias education mark key steps. Direct outreach, trust through partnerships, and more doulas and midwives ensure change moves beyond policy into wards and homes. Lasting progress needs shared action. The challenge remains tied to equity, history, and public health. Every agency, advocate, and family shapes a future where Black mothers give birth safely and with dignity. Sustained, transparent commitment from county leaders, hospitals, and neighborhoods can close gaps and secure fair, safe birth outcomes for all families across Los Angeles.